I have a cyst located on my forehead, but I have a pacemaker with a defibrillator. Will this cause any issues? No, it won't. That's fine, but it is a very good question because a pacemaker with a defibrillator, or even just a pacemaker in itself, can be a problem if you're considering surgery, because a pacemaker is a metal box in your chest, and the problem when we're doing surgery, not minor surgery. So the reason that we can do this is because this would be considered minor surgery. It will be done in the clinic. It will be done under local anesthetic, and most importantly, it will be done with a device called a bipolar diathermy. So there's two types of So diathermy is the kind of sort of like electrical current machine that we use to cut and sort of seal any little blood vessels while we're doing the surgery. It's called a diathermy, and there's bipolar and monopolar. So when we do a minor procedure, we use a bipolar diathermy, and the bipolar diathermy has the electrical current going between two prongs of a pair of forceps. So it's a sort of closed in that circuit. So when we do surgery, we use this little thing where it goes bzz, bzz, it cauterizes any little blood vessels, and that's absolutely not going to affect your pacemaker at all. When you do surgery in the under general anesthetics or more major surgery, you use what's called a monopolar diathermy. And a monopolar, so the bipolar has two poles, bipolar, for which the current goes between. A monopolar diathermy has one pole, so it's kind of like a needle. It looks like a needle. Well, you can get monopolar forceps, but anyway, never mind. That's just one pole of it. The thing you're holding, whether it's a needle or forceps, is one pole of it. And then the current goes between that and a plate which is on your leg. There's a metal plate which is stuck on your thigh usually, or stuck on a fleshy area, and the current goes between the two. And if the current is located in a small area, then it can cause burns. So that's why we worry about piercings. That's why we worry about metal boxes like pacemakers, because it can affect the pacemaker using a monopolar diathermy. So that would be a potentially significant problem if you're having a general anesthetic, perhaps in the house, with a monopolar diathermy. So we would tend to try and use a bipolar diathermy if you have a pacemaker or a metal box or a piercing. Sometimes people have these studs, these what they call dermal anchors, these studs. You can do it for people with these studs, but you have to be a bit careful because there is a risk of burning. So that's why we always ask you to remove all your studs and all your metal work before you have your surgery. That's the reason.